So you've now seen inside the open chest, the open thorax of a goat. And I mentioned that different species have a different lung structure. They have a slightly different physiology, slightly different physiological needs, different size, which means there's a different oxygen requirement. So this is a bovine chest, and this animal has again been used for dissection, but it's used to demonstrate anatomy. So it's got a latex preservative used on it. So you can see that the veins are in blue, the arteries are in red on this animal, but the lung structure is actually very, very different than in the goat, and they have a different lobular structure. But we can see, if we have a look up in the neck, you can see the trachea, or the trachea. This is the windpipe here, with those cartilaginous rings that we described, that really maintain the tubular structure of the chest. And you can see this is the jugular vein, which is blue, and runs in very close proximity to the windpipe, as does the carotid artery and the nerves that are supplying the respiratory system and the intestinal tract come down here as well. So that airway, the trachea, comes down into the chest here. You can see those rings again there. And then here, just above the heart, if you can see the heart just tucked behind the lung, and we've talked about the respiratory system being partly airways and then partly blood vessels as well. So you can see here's the airway coming off the main stem bronchus. That's been dissected here, and this would come out directionally outward here into the lungs itself. So that's how air is conducted into these. And here, this is again the forward and lower, the cranioventral lung lobes, and here this massive lung expanse that again contacts with the diaphragm in the back of the thorax, and that separates the abdomen. And here, sitting against the back of the diaphragm, is actually the liver. So you can see how closely opposed all of these tissues are, and how the structure and function of them are closely connected.